healthy habits.
On Afternoons with Helen Farmer.
I have to tell you, WhatsApp groups, mum groups, completely inundated at the minute with posts about children's health. Many parents also blaming themselves for when their children are getting sick so frequently. Is it a bug that our kids are getting from each other? Is there a present virus at the minute? Is there some kind of immunity situation post-pandemic? I don't know, which is why we brought in the experts this afternoon. We have joined today by Dr. Zsuzsanna Ricz. She's a specialist paediatrician from Emirates Hospital on the Palm. First, though, we've got a clip from mum of two Barbara sharing her experience.
I'm truly affected by all these diseases going on during winter time and also in the past 3 years. These diseases which affect the respiratory systems, they also come with high fever, coughing, runny nose, blocked noses.
I know, Barbara, it doesn't end. Constant coughing at night in our house, lots of snot kicking around. Dr. Zsuzsanna, tell us what's coming into clinic with you.
So, good afternoon, dear mummies, daddies, nannies, grannies, everyone who is interested in the topic. This topic is really hot since the last 6 months, I suppose. And so many questions addressed to me regarding the child's immunity. So what's happening? Is there anything wrong with my child's immune system? And
I guess you're going to say it depends.
I can tell yes and no at the same time.
Okay, can we unpack the yes then, first of all, Doctor?
Yes. So the yes means that is something which is unexpected in the last 2 years. Because there was that everything affected by the COVID period and after the COVID period. So we kept distances, there was home learning, and of course we wore masks as well.
I don't think I've washed my hands so much in my entire life as during that time.
Yes. So it was very demanding.
And as a result, we saw a record low in flu cases and other kind of transmissible diseases. And now we've kind of gone back to our previous ways. What's the impact been on what's coming into clinic then?
So I just like to finish this because it's very important that the experts jumped to the conclusion that during the COVID period and after the COVID period, so because we didn't get any challenges from the other type of bacteria or viral infections, so our immunity got a little bit lazy. So this is everything that we can see, and since 6 months that it's gradually and afterwards suddenly just we have been seeing so many kids who are seriously ill. We haven't expected this before. Very high fever, up to 40, and the children's family, specifically the firstborn child's parents, never experienced this kind of problem, and hospitals were full with children.
I had a lot of friends who had kids with RSV, with pneumonia, bronchitis, children who had asthma being really badly affected, and then all those kind of inconvenient illnesses where it is that snotty nose, it's the coughing at night, and they just can't seem to shift it. It's passing around the classroom, it's passing between siblings. So I wanted to ask you then, when do you come and see a doctor? I'm asking my little one, it started coughing over the weekend, and I was like, here we go again. When is it good to come and see a paediatrician such as yourself, Dr. Zsuzsanna?
So in the first year of the child, the illnesses are very infrequently happening because the immune system is that inherited immune system from the mother and the breastfeeding doing the wonderful job. But after that, it started declining this kind of immunity, and as the child goes to the nursery from 1 year of age, typically, so they start with the many symptoms and very frequent symptoms.
It's a petri dish.
Very frequently happening. 1 day or 2 days and the 1 week, the whole week or more is off because of the child.
It's so frustrating for a number of reasons. One is no one likes to see their child being unwell. You're also thinking about what on earth am I spending my money on when they're not in nursery, 4 days out of 5. And of course, all the logistics around, childcare and now those kind of aspects as well. You mentioned high fevers there, fevers of up, 40. What would you consider a good treatment for a low-grade fever at home? What can be useful for hopefully shifting it as soon as possible?
The low-grade fever doesn't need any kind of specific therapy, not even any medicine. If the fever we consider low, like 38 till 38.5, it doesn't need any kind of treatment. Just be sure that your child will be very well hydrated. Just try to give a reassurance. And of course, if any other symptoms, you have to consider to see a doctor, but only because of the fever. Is just the low-grade one, so you don't have to look for the pediatrician. But if the fever is very high and some other symptoms started developing after 3 days of the high fever, which origin is not known and obvious, you need to seek the pediatrician's advice and some further evaluation.
I wanted to ask you about supporting our children's immunity and doing this when they're well as when they're not so well. So what are some of the things that we should have in our kind of parental arsenal when it comes to boosting our children's immunity?
Yes, unfortunately, I cannot give you only one medicine, like a wonder medicine.
That would be amazing, wouldn't it?
I know.
You'd be on a cruise somewhere if you had that wonder medicine, I'm sure.
Unfortunately, we don't have it. But you have to know that in the last 2 years, the 25 millions of mandatory vaccines were not given worldwide. So please be sure.
Interesting.
Yes.
So during the pandemic, people got out of the habit. I mean, I understand a lot of people had health anxiety about going to a clinic or a hospital, and those routine vaccinations perhaps got postponed, but still a lot of missed appointments.
Yes, unfortunately.
So first of all, get up to date with the vaccinations.
Yes, definitely. So this is the number one that everyone needs to consider. Secondly, there are some kind of vitamins that it's really very important for the healthy immune system. This is the vitamin D. So it's on everyday basis needs to be given. Even though that we are here in Dubai, where is the 300
ironic,
probably 30 days of the sunshine, but we protect ourselves. So of course there is the protection means that we cover our skin. Therefore, the vitamin D is not enough in our body. So please supplement the vitamin D. The vitamin D supplementation should be before 1 year. It's 400 international units. And after 1 year, it needs to be increased 800 international units per a day, every day.
Okay.
So beyond this, be sure if your child is a very picky eater,
I have one,
or some other issues like the vegan or the family doesn't eat meat or so you have to be sure that your child doesn't have anemia, iron deficiency, vitamin B12 deficiency, because it can really affect the immune system.
Dr. Zsuzsanna, thank you so much. Really appreciate your insights on this topic this afternoon. And for some general health advice, is there anything that you want to see children eating more of in their diet so we're not getting to the supplementation stage? What would you like to see us all putting in our shopping baskets?
So everything which is healthy, of course. So every family has the different kind of cuisine and different kind of taste they like, but the children needs the quiet, broad selection of the food.
Eat the rainbow.
Yes.
Thank you. Really, really appreciate it. Dr. Zsuzsanna Ricz speaking to us here from the Dubai Duty Free Tennis Championship. You can find her on the Palm at Emirates Hospital. And if you're a little